anatomy, you hear the lecture, if you don't like it even, put your focus on the lectures. Don't read biochemistry or physiology in the back bench or something with a mobile, scrolling mobile. Don't do it. But you have the liberty to do everything. It is your wish, because for the last 3 batches, अरे की होबे होए जाबे देख लेंगे पीछे. It is not so easy. You have come to a profession that needs hard work, dedication, and also you have to be a good MBBS. Online, these degrees, whatever diplomas or certificates, has no value. It is decorative, but people, who are your clientele, I would say, clients, ব্যবসা করছি আমরা, তো রুগী, patient and your doctor's relation is becoming more or less, that is, the passion is not there. And I'm telling you, you be a good MBBS, is equivalent to a good postgraduate. Because if you are, immediately you don't crack your net for a master degree, then in between you will be preparing and going to different places and practicing. In some polyclinics, some remote areas, you will be going twice a week practicing, and you will be having these certificates. But ultimately, if you, after getting your technology is there at your hand, but you have to know when to use technology, when to use an X-ray or an MRI, when to use a CT or an ultrasound. One of the best tools, I would say, that is the USG. Because even after an MRI, say, of the whole abdomen, again they write, please, USG correlation is required. Why? One report with the investigation, that is ultrasonography, is costs you 1,500 to 2,000, maximum to maximum. Now, ultimately, the reports that is being given by the radiologist, the opinion that you have sent to him, his master is expected. Your friend is a master of radiology, and he will give an opinion. You expect that. But what happens at the end with a star like this? Clinical correlation must. The clinical correlation is must. Then why you go for an investigation? To get an expert opinion. So you have to depend on your base for every subject to correlate and refer. Say you are not getting, just I am myself is an anatomist. But at least after hearing the history, at least seeing any radiograph, it might be MRI or CT scan, anything, at least I can say this can be done, this cannot be done. You have to stay like this without any surgery. তাহলে আমার বক্তব্য হচ্ছে, okay, who Please raise your hands who only understand English, Hindi, don't understand Bengali. Please raise your hand. Okay. Now, why I'm asking you this? Now you are in Bengal. Most of the patients are expected Bengalis. So try to learn, pick up. You speak with your friends. Kemon acho, bhalo acho, like Shah Rukh Khan and Amitabh Bachchan. Ami Banglar Jamai Babu. And crowd is shouting, yelling, like that. At least you take this initiative to learn a language, because it is expected to communicate. And unless you get a good communication, then your findings, your case history, that goes to zero. Please, another thing is that time management. You have to slog it 15 to 16 hours in any format. In between, you have to relax, you have to enjoy, you have to date, you have to go for a Inox movie, anything, party. But I won't say don't enjoy. Enjoyment is life. Even after a successful operation or treatment you have done, you will feel, na eta kichu korlam. As you go, you will feel that na ei patient ta amar bhalo hoye geche. Arekta why I am saying, যেমন AI নিয়ে অনেক কথাবার্তা চলছে, artificial intelligence, everything you just foo and everything will come out. I believe in technology. I want to learn technology, but technology let that demon, I'm calling it a demon, overtake you. So with this, and one thing I tell you, the Department of Anatomy, how many of you visited the museum? Raise your hands. Don't be shy. It is unexpected. It is unexpected. But I would request you, you know each department. You have to know the anatomy department, the biochemistry department, and also your physiology department. Please know that, one thing. Another thing is that in our department, there are lots of resources. Lots. You just see and you observe. Say 10 of your friends, the teacher concerned is demonstrating a bone. You, by that time, you are just not bothered. By that time, if that respective bone is being taught, you look into your dissector manual or atlas or something like that. Don't take anatomy to your home, means hostel. Why I am saying this? Because maximum hours are there you are spending in the Department of Anatomy. If you accumulate, maximum hours are being spent in anatomy department. So after say histology, I'll take 1.5 hour histology. 2 hours are there. So I'll take 1 hour. So you see this slide, the teacher concerned demonstrates to you, and you start doing a picture in your laboratory notebooks. Each week, whatever slide is being demonstrated to you, you try to complete that figure, 1 or 2, 3 maximum. Don't leave it, oh, pore hobe. Don't procrastinate. পরে হবে বলে ছেড়ে দিলে কিন্তু সেই শেষে খাতা সই হবে না. Every week you give me or the teacher concerned in other groups, you get it signed. It is your job to get it done. এটা তোমাদের বললাম, এটা যদি তোমরা ফলো করো তাহলে ঠিক বেরিয়ে যাবে. You have seen a pipeline, a tap at the end. You close it, drop, 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 tick, tick, tick. একটা দুটো করে ফোঁটা বিন্দু বিন্দু পড়তেই থাকে. So you are now in the pipeline. Imagine you will come out in the tap end. তো ডাক্তারিতে পড়ে সে প্রত্যেক বছর ফেল করে যাচ্ছে, তাহলে সপ্তপদী সিনেমাটা দেখেছো উত্তম কুমারের, সুচিত্রার? তো সপ্তপদী সিনেমাতে একটা ছেলে মানে স্টুডেন্ট, হ্যাঁ, he used to fail every time. তো এটা জাস্ট একটা মজা করলাম. তো ন্যাচারালি don't panic. If you don't understand, catch your teacher. Get it done. You think that আমার তো ট্যাব আছে, আমি তো ইন্টারনেটে খুলবো. Don't. You have to use that. But your lecture notes, everything, then you put that tab or, but don't see this phone that way যেমন করে লাগবে, expand করবে, এ করবে, এটা পড়াশোনা হয় না. But if you say, মানে আমি কালকে তোমাদের বন্ধুদের বলছিলাম যে হাতে খড়ি, you know হাতে খড়ি, and when you are just a child, your parents, your grandfather, this is during the Saraswati Puja, they make you write on a slate with a chalk. So lekha pora, writing and then reading. What I want to say is that today you see batch by batch, don't overcrowd and this thing in the over the microscope. You please, you have a child, everyone is having a child. How can you have a child? Your backpack is a child. A bag নিয়ে microscope দেখছে. Why? That load, because microscopy, histology is a very fantastic to see, and you have to have hands, your fingers, your everything has to move and to focus to see a cell. So, and you have to relax. তুমি ধরো ব্যাকপ্যাক দিয়ে এমনি করে মাইক্রোস্কোপ দেখছো, তাহলে দ্যাট ওয়েজ, আমি কালকে একটা ব্যাগ কাঁধে দিয়েছিলাম প্রায় 3 কিলো ওজন. You have been carrying it since your kindergarten. So these are the small things, little things, might be bekufi, it might be, hey, ki bolche sob bhater kotha. কিন্তু এটা মনে রেখো যে যারা নোবেল প্রাইজ পেয়েছে তাদের এরকম এসি টেসি কিছু ছিল না. The inventor of insulin were not given a lab space in a country like America. They were not being given animals how did they do it? তাদের অ্যাটিকে একটা রুম দিয়ে দিয়েছিল, আর the animals used by other researchers were given to them, Banting and Best. No, they discovered insulin. So you have heard the name of Bidhan Rai? Have you learned? So Bidhan Rai, একটা রুগী এলো just with chronic COPD, respiratory some problem. Now, is it a cardiological problem or some problem with the lung? By auscultation, hearing the sounds of the heart and the lung, and also the type of breathing, he used to diagnose. একটা লোক এরকম ল্যাংচাতে ল্যাংচাতে আসছে, এরকম ল্যাংচাতে ল্যাংচাতে আসছে, ঠিক আছে? এবার ল্যাংচাতে ল্যাংচাতে আসছে মানে ও কিন্তু দেখছে, বিধান রায় দেখছে কিভাবে যাচ্ছে। এই গেটটা এক একটা ডিজিজে এক এক রকম হয়। একটা সেরিব্রাল ডিজিজে, একটা স্ট্রোকে এক এক রকম হয়। তো your clinics is sound, your MBBS, be a good MBBS. This is my earnest request, humble request, because we are losing. আমি এটা বলছি with due respect to the modern you people, but you have not, don't think that every place you will get a hospital or something like that. Now what happens? You become a referral doctor. একটা লোক, if someone, an old lady, she comes with a broken hand, wrist, Colles fracture. You, without X-ray, you cannot pull. In our days, আমরা টেনে দিলাম, লাগিয়ে দিলাম, প্লাস্টার করে দিলাম, ভালো হয়ে গেল, তারপর একটা এক্সরে হলো। তো ফার্স্ট রিলিফ কিছু পেলে না, একটু কার্টুনস, you just fold it and give a support, bandage it, give some painkillers and injection, and refer with X-ray, everything, the type of fracture, and you at least get a knowledge if both bone fractures or not, or just a simple wrist fracture or not. You will see when you go in your clinics, you will be seeing that these things are reflected. Clinically you can diagnose. একটা কথা হচ্ছে, এটা কেন বলছি, আমার জার্নিটা খুব বড়, and I want to share my knowledge, share my things, which I have been running it was a 25-bedded nursing home. Initially in 1958 it was established, just 35 kilometers away from Bolpur, by my father. He was just an MBBS. He used to do cataract, he used to do everything. There is no radiology in the district. In those days, at least I saw these things. I learned from him. Give relief. তোমাকে একটা just example দিচ্ছি, একটা big abscess, একবারে তুল করছে, very soft. If the person comes, না এটা অপারেশন করতে হবে, ডাক্তারদের অ্যাটিটিউড এরকম, একটু অপারেশন করতে হবে, আপনি তাহলে ব্লাডটা টেস্ট করান, এটা করান। I'm questioning you, will the blood examination immediately in an emergency, does it has any effect with the management of the patient. First, you will get a radiology examination, blood test. It will burst out automatically. ওটা ফেটে যাবে, তোমার ক্লিনিক ছাড়লো, বাসে চাপতে চাপতে কেউ টিপে দিল বা ধাক্কা লেগে গেল, বাস ওটা পুচ করে বেরিয়ে গেল, বাস রিলিফ হয়ে গেল। কিন্তু রিলিফ হলো, বাট সেখানে ইউ জাস্ট মেক আ, ইফ ইউ আর ফিয়ারিং যে ক্লিনিকে আমি এসব করতে যাবো কেন, just syringe it. You pass, put it in a test tube, if you have that facility in that clinic, and give it for culture sensitivity. That report will come after 72 hours. Then you go for blood investigation. You prescribe antibiotic, put a bandage, and give a support sling, and then you get these things. 5 দিন ওষুধটা খান, আসুন, তারপরে দেখছি। তো এটা একটা সোয়েলিং, এটা হেমাঞ্জিওমা না অ্যাবসেস না একটা সলিড নিউরোফাইব্রোমা or lipofibroma of your lipoma, it has to be diagnosed. Then accordingly, they have hemangioma. So hemangioma, you just compress and hold it, leave it. Then that again regains its own shape. But in abscess, it won't. ঠিক আছে? So be a good MBBS. I want to see all of you, because I'll be in the campus expected when you pass out. Now you have become one person practicing in Darjeeling. Okay. Now, I always say, even in Jharkhand, that it is left up to the God. So many deliveries are being done, left in the hands of God. Like Ambrose Parry, he is told that I dressed the wound, God healed it. God heals it. But you are the person sent by God to manage it, to catalyze the events. পড়বে, টেকনোলজি ইউজ করবে, এটা গেল। আর একটা কথা, টাইম ম্যানেজমেন্ট। অ্যানাটমি ডিসেকশন হলে ওই 2-4 জন করছে, 2-4 জন দেখছে। No, you will be seeing dissected parts. So be in a group. ওখানে তোমরা দুটো 15-20 ঢুকছো, তারপরে একবারে ভাগ হয়ে যাও একটা জায়গায়। এবার নাও ইউ আর হ্যাভিং অস্ট্রোলজি। তো অস্ট্রোলজিতে দেখতে পাচ্ছে না, ওইখান থেকে দেখাচ্ছে। আরে ভাই, তোমাকে অনলাইনে তুমি যখন রেজিস্টার করছো কোনো কোচিং সেন্টারে বা কোনো কোচের আন্ডারে, দ্যাট ইজ আপ টু ইউ। ইউ হ্যাভ টু রেজিস্টার অর ইউ ডু হোয়াট এভার format that you have to. What I want to say, you make a balance, how much to stop and how much to go, but ultimately you have to put it in pen and paper. যেমন previous batch, your didi, dada, whoever, she came and told me, I brought this book. এটা পড়লে হয়ে যাবে? I brought this book, এটা পড়লে touch and pass. Touch and pass, anatomy, physiology, biochemistry, এটা হয়। কিন্তু আমরা লিখছি, বই লিখছি, আমরা প্রফেসররা লিখছি। That is যারা লিখছে, whoever is writing, it is their wish. They have the liberty to this thing, but I don't encourage this. একটা গ্লিম্পস নিতে পারো। I am saying your classes কে forfeit করে দিয়ে বাঙ্ক করে দিয়ে তুমি বাড়ি যাবে, গো টু ক্যালকাটা, তুমি ক্লাস বাঙ্ক করে দিয়ে শান্তি ধরছো। ওয়াই? শহীদ এক্সপ্রেস আছে, ইয়ে আছে, তারপরে এখন তো সেফ সেফ সিটি কলকাতা, মেট্রো আছে, তোমার ট্যাক্সি আছে, বাস আছে। So it reaches Calcutta at 8, you reach by Salt Lake by 10. Or you catch the morning train without bunking. তুমি অ্যাটেন্ডেন্সটা দেখো, অ্যাটেন্ডেন্সটা হচ্ছে তুমি দিয়ে দিল, এ করে দিল, তারপরে তোমার শর্টফল হলো 30 days। তোমরা গিয়ে সেই তোমার বাবা আসছে, মা আসছে, এমনি করে ওর একটা অসুখ হয়েছিল, শরীর খারাপ ছিল, হ্যাঁ, এই রিপোর্ট নিয়ে চলে এলো, হতেই পারে। কিন্তু অথরিটিকে না জানিয়ে পড়েছে। এবার আমরা কি দেখবো? আমরা দেখবো অ্যাটেন্ডেন্স আছে কিনা। তো আর একটা জিনিস, ইউজ অফ ফোন। তোমরা ক্লাস সকালবেলা একটা হ্যালো, গুড মর্নিং, যাকে যা বলার বলে দিলে, have a bath or shower, whatever it is, who is comfortable in the morning or in the evening. And I would prescribe to take 2 teaspoons of honey, 4 dates, khejur, 4 to 6 almonds, and kaju kismis, and 1 akhrot. Now you soak the thing in the evening in a bowl, water overnight. You just go to your potty and thing, you come down, you peel the almonds, that's brown, I would say skin, you just peel it, because that has tannin. If you take it directly, it will regularly with the skin on, then you get gastritis or some gastric problem. You take this, come. And late night, you have been practicing late night studies. এবার ওটাকে আস্তে 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 উইথড্র করো, রাত 1টা অবধি পড়াশোনা করো, ভোর নাহলে 6টার মধ্যেই তুমি ওঠো, উঠে তারপরে তুমি এই সব ফ্রেশ না বলে যা করলে মধু ইয়েটা খেয়ে rush for breakfast. If you at times, if you are not having the time, or you will be having the time taking the breakfast, this bolus, this, what to say, it will give you a fullness, and also it won't destroy your health. আর উইকেন্ড করবে, সুইগি খাবে, জোম্যাটো আনবে, সব কিছু আনবে, হ্যাঁ, you enjoy, you do fest, you do go to films, anything you want to. আমি বলছি মানে আমরা অনেক বদমাশি করেছি, কিন্তু বদমাশি করেও আমরা প্রচুর কাজ করেছি। এটাকে যদি বদমাশির পর্যায়ে ফেলো তাহলে আলাদা কথা, বাট ডোন্ট ignore your studies and don't be in the mercy of us. আমরা হয়তো একটা নম্বরের জন্য একটা গন্ডগোল হয়েছে ছিল, কারণ 2 years অ্যানাটমি ছিল, গ্রেজ অ্যানাটমি পড়তাম, no notes, nothing. Professor Samar Mitra's anatomy, you know, he's one of the brilliant teachers of India. হ্যাঁ, তো Samar Mitra notes were come in psychostyle, the yellow notes it was known. Then came Ashim Datta. Then they printed books when we were out. But this anatomy now has come into 1 year's course. Out of that 2 months, এই বাড়ি যাওয়া, অসুখ, ঝগড়া করা, তোমার বয়ফ্রেন্ড আর গার্লফ্রেন্ডের সঙ্গে ঝগড়া করছো, মার্কেটিং করছো, শপিং করছো, উৎসব হচ্ছে, সব কিছু হচ্ছে, 2 মাস চলে গেল, তার মানে 10 মাস, তার মধ্যে আরো 1 মাস চলে গেল, 8 থেকে 9 মাস ইউ আর গেটিং টাইম, 8 to 9 months মিলিয়ে নেবে, Now I will go into the lecture of cartilage. হ্যাঁ, আসলে আমি একটু ভাষণ দেওয়া অভ্যাস করছি, তার কারণ আমি রাজ্যসভায় প্রণব মুখার্জি, late finance minister প্রণব মুখার্জি of the Congress party. So রাজ্যসভা আর লোকসভা আছে। লোকসভায় you have to election লড়ে আসতে হবে, you have to fight an election. তো রাজ্যসভায় তোমাকে পাঠিয়ে দেবে, হেমা মালিনী, জয়া ভাদুরী রাজ্যসভায় পাঠিয়ে দিয়েছে। তো আমি ওই রকম একটু মানে I want to become a রাজ্যসভা MP. With this short note and request, and drink plenty of water. Winter is the season for dehydration. Karan, if you are in summer, you will be drinking. And whenever you are in the hostel, drink in glass. Don't just see, it is just quenching this thirst. একটা হকারের সঙ্গে একটা প্রফেসরের তফাৎ নেই। কেন বলো তো? ট্রেনে যাবে, একটা হকিং করছে, এই কলা কলা কলা, আর 2 ডজন আছে, কিন্তু সে তার ঝুড়িতে রেখেছে লোকাল ট্রেনে একটা জায়গায়, সে আবার নিয়ে আসছে আরেকটা কম্পার্টমেন্টে। দ্য ওয়ে ইউ হ্যাভ টু রিপ্রেজেন্ট। আর একটা কথা হচ্ছে, বি কাইন্ড অ্যান্ড প্যাশনেট। অ্যান্ড এই দুটো ছবি দিয়েছি তোমার অ্যানাটমি ডিপার্টমেন্টে। অ্যানাটমি ডিপার্টমেন্ট দেখবে ডান দিকে হিপোক্রেটিস, বাঁ দিকে সুশ্রুত। You see this, study this just picture. You see how Hippocrates is placing his palm in the liver and try to this thing. The mother of the child is there. এর মধ্যে অনেক বার্তা দিচ্ছে, অনেক সিগন্যাল দিচ্ছে, অনেক কিছু বোঝার আছে ছবিটা থেকে। যে ওর মা কিন্তু ওই ছবিটার কথা বলছি, যে না, মাই চাইল্ড ইজ ইন সেফ হ্যান্ডস। আর একটা কি, বাঁ দিকের ছবিটা হচ্ছে দি গ্রেট আয়ুর্বেদিক সার্জন সুশ্রুত। He is doing rhinoplasty. Criminals রাজা নাক কেটে দিত, cut off the nose. So he used to, from the forehead, make a nose for that. That means so much focus, so much without anesthesia. They used to give opium or some type of these drugs and get that operated. And at least I am exploring Ayurveda. I am exploring in the treatment. People might say he is a mixopath. Mixopathy means Ayurveda and allopath cocktail. But it is not so. Your body system works in a different way. Okay? Follow. Cartilage, it is a modified connective tissue. Cartilage cells, chondrocytes, are widely separated by intercellular matrix, material or matrix, fibers. Classification of cartilage: hyaline cartilage, elastic cartilage, white fibrocartilage. Hyaline cartilage, most common variety of cartilage, consists of gristly mass of firm consistency, has considerable elasticity. Next, gets nutrition by diffusion. Okay. Now, except in the articular ends of bones, it is covered externally by a fibrous membrane, the perichondrium. You can see matrix, homogeneous, basophilic. Just under the perichondrium, it is acidophilic. Next. Chondrocytes are present in cavities, the matrix called lacunae. Next. Each lacunae generally contains single cells towards the central cells arranged in groups called cell nests. Immediately around the lacunae, the matrix stains deeper called the territorial matrix. Interstitial matrix is the pale staining matrix between the territorial matrix. Now you see the interterritorial. Now, interterritorial matrix, this is territorial matrix, 3 isogenous chondrocytes in the lacuna, this is the lacuna, and the nuclei of chondrocytes look like this, territorial matrix, interterritorial matrix, okay, lacuna is here. Now, matrix, lacuna, chondrocytes, and 4 chondrogenic layer, 5 the perichondrium. Next, distribution. Costal cartilage, articular cartilage, thyroid cartilage, cricoid cartilage, arytenoid cartilage, tracheal rings. Now, these are the places. The name itself signifies costal cartilage. Costa, ribs. Two skeleton are hung in the দুটো আছে তো ডিপার্টমেন্টে দুটো skeleton আছে তোমরা ওখানে those who have not procured personal bones or groups or your partner, you go to the department, Vivek is there, you request him, you sign and take the artificial bones. Artificial bones. There are lots of resources and study. আগে যাবে ঝটপট গল্পটা করে আগে ইস্যু করে নেবে আবার যাওয়ার সময় দিয়ে দেবে তো now see articular cartilage articulation the joints they have lined by the bony portion for easy movement and when you think of movements you see with salsa dance, different dances, you see how they bend, the acrobats, every part has to, নাহলে তো আমরা এরকম করে চলতাম কিন্তু man was made in such a way that it had to get into the movement. Previously, we are quadrupeds, gorilla and all this. You will see in the history of medicine. If you go up on the first floor, you will see the pictures. In the museum, you will see. Plus, because previously the gait was like this. But we became erect, evolution of erect posture. It's very interesting. And with this adaptability, this function will all depend on the head to your foot, how the spine is maintained, the movements. Now, it's just bone, but there is cushioning. Just say, I'm wearing Crocs, gifted by a daughter. Previously, I used to wear some shoes, Batas. But I stand at least literally 12 to 14 hours, 12 hours, 10 hours. Again, I rest. So, it is very comfortable. Why? That cushioning is there. Similarly, if a cartilage gets damaged, say suddenly one person comes, complains that over here it is paining, very excruciating pain. Then what happens? You just gently see. Should I, like this. Even respiration is some problems there. So this is from inflammation of the cartilage. Understand? So this tracheal rings, you see your own, তোমরা তোমার ফ্রেন্ডকে মডেল করবে, হ্যাঁ, and study anatomy. ধরো যে একটু এখন জিম টিম করছে বা মাসল আছে, তাকে বলে বাইসেপস দেখা, বাইসেপস। তো সলমান খান, শাহরুখ খান, ঋত্বিক রোশন, এই বাইসেপস কার সবচেয়ে মোটা? কার সবচেয়ে মোটা বলো? তো now thyroid cartilage, cricoid cartilage, and arytenoid cartilage. When you go to the study the pharynx, larynx, then these things, arytenoid cartilage, vocal cords, small cartilage. If you see the previously when there was no endoscopy, but you won't be having endoscopes in where you are practicing. But if any person comes with a complaint, you can see it, view it with a mirror. They bolbe, knee bolun. If you some vocal cord paralysis or some growth in the vocal cord, the arytenoid, these cartilages get fixed. The movement is not, or one side, say right vocal cord is okay, and the left is not, the movement is not like this, like this, like this, like this. তার জন্য কি হয়, অনেক সময় খুব যারা চিৎকার করে, তো তখন একের সময় স্বরভঙ্গ হয়, মানে একটা ভয়েসের তখন ক্র্যাক করে যায়। ইট ইজ ডিউ টু একটা যে ইনফ্লামেশন হয়ে গেছে। ঠিক আছে? Now these are the location of these cartilages. Next, elastic cartilage. The structure of the elastic cartilage is almost same as that of the hyaline cartilage, with perichondrium, chondrocytes, and matrix. But the main difference is that instead of collagen fibers, the matrix contains numerous elastic fibers. Now this is the difference. So you might have that short question, 2 marks. আমি জাস্ট বলছি আর কি। তো এই যে ডিফারেন্সটা বলছে যে what is the structure of the elastic cartilage, almost the same as that of the hyaline cartilage. What is the difference between elastic and hyaline cartilage? With perichondrium, chondrocytes, and matrix. But the main difference is that instead of collagen fibers, the matrix contains numerous elastic fibers. Get it? Next. The ground substance contains abundance of branching and anastomosis elastic fibers. This type of cartilage is found in the external ear, epiglottis, external auditory meatus. Now this is the histological. Next. Now see, this is the perichondrium. This is the chondrogenic layer of perichondrium, lacuna, and chondrocytes, elastic fibers. These are the elastic fibers, these are the elastic fibers. And cartilage matrix with elastic fibers. Nuclei of chondrocytes, the nuclei. This is a venule, this is a vein. And next, white fibrocartilage. Next. It is found in limited regions like in the pubic symphysis and intervertebral disc. Now, see, now this is the Now these two hip bones, the pelvic girdle, is united in the symphysis. We have the bony part in this part by a cartilage. That's why in previous days and in emergency basis, symphysotomy to deliver a child, normal delivery, তখন তো cesarean section হয়নি, তখন they used to slice off this cartilage. ফলে কি হতো, এটা আর এটা এই দুটো একটা কুশনের মতো থাকছে, normal. So you will see in your dissection. Okay. Now next, pericordium is characteristically absent. Next, the fibrocartilage, collagenous fibers, lacuna and chondrocytes. Next, nuclei of chondrocytes, collagen fibers, lacunae, collagen fibers, cartilage, row of chondrocytes. Next. Thank you. Discovered the technique of plasticization. Plastic ঢুকিয়ে দিচ্ছে, মানে you say he's a wonderful person and discovered many mummies. It is, but that's a great thing. That mummies have a different process of mummification, still unknown. But plasticization, Madame Tussauds museum in London, শাহরুখ খান দাঁড়িয়ে আছে, ক্যাটরিনা দাঁড়িয়ে আছে, এরকম করে তোমরা যখন লন্ডন যাবে তখন তাকে জড়িয়ে একটা ফেসবুকে পোস্ট করার জন্য একটা ছবি তুলবে. That is made by wax. But Professor Higgins, he injects, means now he's having Parkinsonism, different this thing. But I met him, he is a down-to-earth person. He is the first discovery of plasticization, and the poster is there, that is on malformations. It's my poster in Singapore University. And I was given just 2 meter, 2 meter মতো জায়গা. I requested Dr. Tay, give me more space. I took only 2 sets of clothes and the rest all posters are there. Those were the days were handwritten. Now you'll get prepared in PowerPoint, computerized, and then get it done. This each and everything was done. Next, daga. Now, next. Now, your gateway to medicine. Anatomy is your gateway to medicine. That slogan is mine. So you see each and every component. Next. Book list. Next. These things, the basic things you have to learn. From whatever anatomy book you have taken, purchased, you just read that. Because, and don't overcrowd your server. This is your server with different books. ও এসে বললো না আমারটাতে খুব ভালো আছে, কিছুই ভালো নেই, বেসিকটা বলবে, বেসিকটা লিখবে, পাস করা যাবে, কিচ্ছু নেই. সব বইগুলোকে যদি অ্যাকুমুলেট করা হয় দেখা যাবে গ্রেজ, ম্যাকগ্রিগার্স সেখান থেকে নেওয়া হয়েছে. Nothing has changed. The liver has changed, except in pathological conditions. So, what is the anterior surface, posterior surface, dorsal surface, the planes of the thing? You see it from your respective textbooks. Next. These are anatomical positions. Next. These are planes of the thing. Next. See cross section, longitudinal section, how it is cut. Next. Next, these are the next, 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 next. Plus a small letter by worried worried mother Dr. Angara Herud addressed to her son who had just got admission MBBS in Seth GS Medical College 26/9/215. The mother is a doctor, is a doctor, and his son got admitted in JS Medical College. Now, you are one of the lucky few chosen to be the proverbial hand that heals, makes you an angel of God. But remember, you are not God. Always do your duty as best as you can. Put your heart and soul into whatever you do. Treat each patient as your own kin, but do not expect to win each time. Now, I am a doctor. At times, I have to sit in the opposite side of my friend or my teacher or some other physician unknown to me. So you always put yourself, when you are treating, এটা আমার ছেলে বা আমার মেয়ে বা আমি নিজে, what will be your expectation from your friend, doctor friend? What will be your expectation from your teacher? You expect the best. So you give the best, whatever your head permits. And if you are knowing that I have to refer it, you refer to the person concerned, so that life is being saved. And this is one thing. Next, just like any other profession, you will face unsurmountable challenges when your heart may bleed, your patient, but your hands may be tied, compelling you to fail. Then, my dear son, continue to do your best. Have faith in God, have faith in yourself, as you have done all that God could be done. Above all, stop expecting anything from anyone. The world is a strange place. On one hand, you will find patients falling at your feet, thanking you profusely for saving their lives, placing you on a celestial altar. And on the other hand, you will see emotionally charged, aggressive relatives venting their anger at the loss of their loved ones, despite your untiring and best efforts. What I would say, what I do personally, they have brought a patient in crisis. After seeing, you start your treatment and call the patient party. Call this thing, make them sit, and you explain to them. You take a piece of paper and you explain that he's got a head injury. In my place, this cannot be done. I refer it with a IV drip and whatever painkillers and the treatment management for a better center. Because now Bengal has the most beautiful infrastructures. So it's not, I can refer to mission, refer to this thing. That thing, if you sell, then you move. With you, whatever you are finding, এখানে যদি RTA, road traffic accident, এখানে একটা ফ্র্যাকচার হয়ে গেছে, ব্লিডিং, গ্যাসপিং, হ্যাঁ, তখন তাকে অক্সিজেন দিয়ে তারপরে পাঠিয়ে দাও। আর now, next, remember, both these extremes of emotions are untrue. Yes, they are mere emotions. What truly and only matters is that you do your best in all situations. Don't get bogged down by incident like this. There will always be patients and relatives who cannot understand you or the situation. Do not expect that people will understand you. Life will always be unfair. You don't need people's sympathies. Next. All you need is to remain calm, composed and yet firm. Never ever regret your decision of taking up medicine. Never ever. Like, I'm the fourth generation doctor, but if I believe in rebirth, I always pray that I will again become a doctor. Because I've seen, and most of the things I've documented. It is in videos, it is in this thing, your photos. That's one thing I tell you, young children with cleft lip. I have to do it free. And I can give you an address in Nanur. That girl, he was just a kid, there was no such anesthesia, with local anesthesia, I repaired her lip. And now she's married with a child, and his husband runs a cyber cafe, and she herself runs a beauty parlor. Just 15 kilometers. So you, at least nowadays I don't do it because I Operation Smile. They'll select this Operation Smile train that repairs cleft and do some basic the plastic surgeons. And they are moving throughout the world, taking young plastic surgeons to train them and trying to repair the cleft. Now, always remember, those who run away from challenging situations or get delusion don't deserve such a rewarding profession. Let the businessman of the world make it their money. Let your friends in the corporate world go globe-trotting, living like a king style. Remember, each of them have their own problems, pressures. There are risks that need to be taken in every walk of life. তো কেন বলছি, আমার এই ভাঙাচোরা নার্সিংহোম, মানে আজকের সঙ্গে মেলাতে গেলে ভাঙাচোরায়, সেখান থেকে আমার my nursing home was a resource center for IIT Kharagpur Medical School. And I was given a post, permanent post there, but I refused because I wanted to stay here. And I, at the back of my this thing, this is a slogan created by me, and the name Honey Doctor was given by one of the eminent this thing, Ayurvedic surgeon, Dr. Professor Pradeep Devnath of JB Rai Institute Ayurved College, but unfortunately he died of heart attack. He called me a honey doctor, and he certified. And I was traveling 5 days a month or a week to IIT Kharagpur Medical School, where I have contributed with 6 PhDs and 6 Master of Science. They are now in different posts, different places, with my friend Jyotirmoy Chatterjee, who is a professor there, retired recently. Now we are trying to write these 6, 12, they'll be the authors on wound healing properties of honey in different modern aspects, and also my traditional dressings. I dress wounds with honey. So Santiniketan Medical College is a fertile place. You have to be like Ganeshji. Put your ears like this, your eyes like this. Ganesh ji, not Ganesh Chaturthi Puja Aarti banane hai. Lekin what happens, I'm saying you scrutinize. You see into the depth is what's happening. Even you can become like Bidhan Rai. Because I challenged my father. In those days, he used to operate and things. So I challenged, I stayed back into the roots, and I am happy at the end of the day. Catastrophes are there, but if you slowly, now these things are being taught, how to behave with the patient, how these things in America, on states. So technology is not the last word for medicine. And don't regret, and don't tell your problems. যে মা ভালো খাবার নেই ফোনে কি হলো রে কি হলো তোর বিরিয়ানিটা পাচ্ছিস না আমি তাহলে বাড়ি চলে আয় চললো শান্তিতে বিরিয়ানি খেতে দুর্গাপুর চলে যাচ্ছে বাস ধরে don't be in the campus study avail all the opportunities your library facilities you sing dance and wish you all the best. Next. Life is not a bed of roses for anybody. Remember, you are here for a purpose on a mission. Your biggest and best reward is this smile, smile on your patient's face, in your student's face. If you are a teacher, the gleam and the gratitude in his eyes, which is beyond all the money in the world put together. So, feel love in your heart, courage in your soul, and smile on your face, and put your best foot forward each day. For you truly are God's own children. We are there always to facilitate your learning. Thank you very much. But you please phone নিয়ে বসবে না ক্লাসে তাহলে কিন্তু ব্লান্ডার হয়ে যাবে যা আঁকছি এই যে শ্যাবি ড্রয়িং করলাম আর এখন থেকে every time you try to draw a sketch because my prescription is always having a sketch. Dharo, Sridevi's mother was operated for a problem. She had a problem on the left side of the brain, but she was operated on the right side. In a place like America. So you keep a note, always make it a habit. আমি দু চারটে প্রেসক্রিপশন দেখাবো ছবি তুলে এখন তো খুব সহজ ফোনে নিয়ে আসবো তারপরে প্রজেক্টরে দেখিয়ে দেবো যে ওটাও একটা আমি এই মাঝে মাঝে তোমাদের বলতে থাকবো তো আজকে তোমাদের কাজ হবে যারা আমার ক্লাস করবে তারা আসো আমি দেখাই আর একটা কি others you the day Vivek please you contact Vivek get your pen drive and at a pen drive doesn't cost much 32 GB ওটা কত এই ওই ভিডিওটা মোটামুটি একটা ভালো পেন ড্রাইভ